Today we are going to discuss about the Chikungunya fever. So Chikungunya is a mosquito-borne viral disease and characterized by abrupt onset of fever. Okay, that means in the symptoms, when they will ask you about the symptoms of Chikungunya fever, you have to mention about the fever at a temperature of 102 degree Fahrenheit to 104 degree Fahrenheit. This is the characteristics of the Chikungunya fever. Okay, so Chikungunya is transmitted by mosquito. So here it is an example of disease where mosquito play a role of delivering virus. Okay, because earlier we have seen about dengue, right, where it transferring viruses, and we have seen about malaria, where it is transferring plasmodium, which is of protozoan species, right? So that means mosquito can transmit anything of which it is infected, right? So the first thing is, the mosquito who is infected by the chikungunya virus can transmit the chikungunya into the human. Okay, and again the mosquito will be female, because only female mosquito needs blood meals for their egg maturation. So female mosquito, mainly the Aedes albopictus or Aedes aegypti, here the mosquito that transmits the infection. Okay, so Aedes albopictus and Aedes aegypti both activates predominantly during days, and their activity is at peak during the early morning and the late afternoon. Okay, so they mainly activated during the day, so we have to be very careful during the day to be away from chikungunya virus. So now Aedes albopictus and Aedes aegypti can bite us outdoor mainly, but Aedes aegypti have the ability to bite us indoor also freely. Okay, and Aedes albopictus, Aedes aegypti can cause outbreak of chikungunya fever during most of the times. Okay, and the most important thing that you need to know, that outbreak of chikungunya is more common after rainy season. Why? Because in rainy season the mosquitoes are actively breeding, then it will be ready for causing to play the role of a spreader of that infection. Okay, so here the incubation period is 3 to 7 days within a range of 1 to 12 days. Okay, along with the spreading by mosquito, we have seen in case of malaria that it can also be transmitted via blood. So is chikungunya can also be transmitted via blood? So although theoretically it is possible, but there is no such evidence, okay, that is recorded until now. And it can be rarely transmitted by mother to the newborn. Okay, so 3 transmission procedure. One is the transmission by female Aedes aegypti and Aedes albopictus mosquito. Another one is by mother, which is rarely observed, and another one is blood transfusion, that is possible but not till date recorded. Okay, so another thing that I want to mention you, that this Aedes aegypti and albopictus can also transfer Zika virus, yellow virus and dengue virus. Okay, I have written here also. So that is the idea. So now it most oftenly causes death. Okay, most of the cases it causes serious problem in adults who are already with some chronic infection. And a person, if once infected with chikungunya, there is a chance that he or she will be protected from further infection by that chikungunya. That means what? That means our immune system can recognize it very well. Our immune system can recognize chikungunya very well, so that when second time it try to infect our our immune system can easily recognize it and remove it from our body. right? That is why once a person is infected with chikungunya, there is a no chance that he or she will infect it by it again. Okay, so what are the risk factors? So a person with heart disease, a person with respiratory disease, persons who are above 45 years old, and person who are in alcohol disease. In such cases, he or she may develop heart failure, pancreatitis, myocarditis, okay, pericarditis, renal failure, hepatitis, and pneumonia. Okay, so 4 things in the risk factor. One is your heart disease, another one is your respiratory disease, another one is if you are above 45 year old, another one is if you are in alcohol disease. Okay, so in case of alcohol disease, you may develop, if you are infected with chikungunya, heart failure, pancreatitis, myocarditis, pericarditis, renal failure, hepatitis, and pneumonia. Okay, so that is the risk factor. So now what are the symptoms observed? So the main important thing is the joint pain may occur, which may occur in more than one joint. Rash, headache, fever is important. I have told you. Muscle pain, nausea, vomiting, diarrhea. Okay, so joint pain that can be occur in more than one joint. Fever, nausea, vomiting, diarrhea, rash, headache. Okay, although most of the symptom will resolve within a few days, but the joint pain will withstand for weeks and for months, and even in some cases for years. Okay, so that is the symptom part. So how the doctor can diagnose it? So as you can see in the symptoms, there are many symptoms that is common for variety of conditions, right? For example, fever. You may develop fever in case of malaria too. Okay, in case of, for example, headache, there are various kind of symptom disease that shows symptoms of headache, right? And for example, vomiting, diarrhea, you can observe diarrhea and vomiting in E. coli infections too, right? So how, for the first goal of doctor will be to rule out those common symptoms. Okay, because he or she need some unique characteristics of the chikungunya to identify. So the first goal of him will be to rule out other symptoms. Okay, and he or she also have to find out that whether his or her patient has traveled in a area or spent some time in a area where virus is in predominant. Okay, within the last 12 days. Because why last 12 days? Because I have told you the incubation period is 12 days. If it is a chikungunya virus infection, then the symptom will start showing itself after 12 days, right? So if that two condition is yes, then the doctor will go for ELISA test. Okay, and in the sample he will find the IgG or IgM antibodies. Okay, and the level of IgM will be at its peak during the 3rd to 4th week. Okay, and it lasts for months. Okay, so IgG and IgM will be detected with the help of ELISA, or viral isolation may also be done. And prevention is very similar to the what we have discussed in case of malaria. Okay, that means our mosquito repellent, using protective cloths, using bed nets, using a particular clothing when you are in outdoor, avoid outing when Aedes albopictus and Aedes aegypti is active, and most importantly, drainage of stagnant water in swamp and ditches to reduces the breeding areas. Okay, that is the important prevention. So that is all about chikungunya virus. Okay, so it is a chikungunya fever is mosquito borne viral disease. Okay, so it can transferred by female Aedes aegypti or Aedes albopictus mosquito if it is infected with chikungunya. Okay, so Aedes aegypti and Aedes albopictus mostly bites during day, and its activity is at its peak during the early morning and the late afternoon. Okay, and Aedes aegypti and Aedes albopictus can bite during when you are indoor, when you are outdoor mainly, and Aedes aegypti can bite during when you are indoor also. Okay, and incubation period of chikungunya virus is mainly 3 to 7 days and within a range of 1 to 12 days. Okay, that is the incubation period, and most of the cases it may cause serious problem to adults who have developed chronic disease. Okay, and another important thing that I need to mention, that chikungunya virus once infects a person, the person would likely to be never infected by chikungunya again. Okay, so now we have seen about the risk factors, right? Heart disease, respiratory disease, then individual who is older than 45 age and who is in alcohol disease may be in risk factor, and alcohol disease person may also develop heart failure, pneumonia, pericarditis, myocarditis, renal failure, hepatitis if it is again infected with chikungunya. So what are the symptoms? So you may develop joint pain occur in many of the joint, you may develop a headache, you may develop fever that range from 102 to 104 degrees centigrade, rash, muscle pain, nausea, vomiting, diarrhea, and the symptoms usually resolved within few days, but very importantly, the symptoms will last to mainly the joint pain will last for few weeks to months and even years. Okay, and diagnosis can be the first goal of doctor to rule out all the common symptoms and to rule out whether the patient has traveled or spent some time in areas where virus is predominant. Then he will find out the presence of IgG or IgM antibody which is against the chikungunya virus. With the help of ELISA or viral isolation may also be done. Treatment is usually no treatment is required. Our immune system is strong enough to fight against it, but resting may preferred for quick recovery, and also if medication is very important, then ibuprofen and acetaminophen can be used. Along with, we can also apply fluid. Okay, and I have told about the prevention too, that mosquito repellent, mosquito protective clothing, then mosquito netting can be used, and reducing the stagnant water in swamps and ditches is also important, because this will reduces the chance of breeding. Okay, that will in turn reduces the number of mosquitoes, so the chance of transmission will be lowered, right? So that is the idea of chikungunya virus. So I hope this video will be helpful to you, and thank you for listening to this class.